I am Dr. Tuba Khan, and along with me is Dr. Muhammad Khalid Laghairi. We are postgraduate residents from Sheikh Zayed Hospital, Rahim Yar Khan. And we have done a study in our hospital in collaboration with our department, which is exploring drug addiction screening prevalence and its associated factors among security guards in a tertiary care hospital. We have done this study because, as we all know, that addiction and substance abuse problem is on the rise in the whole world, and especially in Pakistan. And assessing addiction among the security guards is very important because of safety reasons and policy formulation. And not much data is available in this regard. जो कुछ prominent जो data है वो available है United Nations Office of Drug and Crime का. If we look at the methodology, we have used cross-sectional study, and purposive convenient sampling is used in our study. If we look at the results, we have recruited 184 security personnels in our study. 172 among those were males and 12 were female. Among those, 146 were married and 38 were single. If we look at the age group, जो हमारे range थी age की, that was from 15 years to more than 50 years. But the major chunk of the security guards was between 25 to 29 years, which is 35.87%. After looking at the data, we came to know that most of the guards were from Rahim Yar Khan and only one from was Liaqatpur. Other major finding, other than the drug addiction, of course, was regarding the blood pressure and BMI. When we checked the blood pressure of the guards, we came to know that 29.3% were had stage 1 hypertension and 15.8% had stage 2 hypertension, which is quite alarming. And as obesity is on the rise, so after looking at the BMI, we came to know that 26.6% were overweight and 6.5% were obese. This data regarding the hypertension and BMI is quite alarming, especially among the security personnel. When we see the drug addiction among these security guards, we came to know that one was taking opioids, two were taking methamphetamine, three were taking tricyclic antidepressants, and one was taking benzodiazepines. For nicotine, pan, and Naswar, we use self-reported questionnaire, and 17 reported taking those substances. Over to you, Dr. Khalid.
Thank you. Research is an evolving process, and हमेशा इसमें limitations की गुंजाइश है. और जो हमने study design use किया, that was cross-sectional study. And इसकी limitation ये थी कि we cannot establish the cause. That's why it's the limitation, and we want that further studies should be conducted like case control and cohort. Like previously Dr. Tuba told that sample size, it was 184 and mainly from Rahim Yar Khan. That's why the sample size was small, and it was collected from the one area basically. So this is also a limitation because we cannot generalize this result. And the sampling technique that was used is purposive. So there is a risk of selection biasness in this study. And there is no test that we can check about the tobacco and tobacco related products here. That's why we use the self-reporting scale. But there is a stigma associated with the tobacco and tobacco related products like pan and chalia, etc. So maybe there is underreporting, and so this is also a limitation in our study. And the drug kit that we use due to our limited budget, that was the drug screening kit, and the sensitivity and specificity is not established. So that is also a limitation, and we have to use this because we don't have any other option available here. And there are also some recommendations based on this study. First of all, regular health screenings. Because the security personnels, they are directly associated with our security, and if we do not check the health of these people, then definitely we can also suffer. And the security personnel were associated with the chronic conditions like diabetes and hypertension, and that also increases the risk of psychiatric illnesses in this community. That's why it can also impact our security issues. There is also a need to develop interventions to encourage the healthy habits among this population, and we have to prevent the chronic diseases associated with these professionals. And also the substance abuse is rising, इसलिए हमें इसकी education के ऊपर काम करना है, और जो security guards हैं उनके substance abuse के ऊपर कोई काम नहीं हुआ. और based on this study, we recommend that every hospital should conduct जिसमें कोई भी ऐसा सेमिनार हो, कोई ऐसी चीज़ हो जिसमें उनकी जो सब्सटेंस अब्यूज़ है उसके ऊपर बात हो और किस तरह उसको प्रिवेंट किया जा सकता है. तो एडमिनिस्ट्रेशन के साथ मिलके तो इसको किया जा सकता है. एंड एडिशनल रिसर्च इज़ आल्सो रिक्वायर्ड, बिकॉज ये जो स्टडी है ये मेनली फ्रॉम रहीम यार खान, और जो प्रीवियस एक स्टडी है यूनाइटेड नेशंस की, उन्होंने ये बताया है कि जो हॉस्पिटल्स हैं उनमें भी डिफरेंस था जो सिक्योरिटी गार्ड्स थे. तो इसलिए जो हॉस्पिटल टू हॉस्पिटल एंड एरिया टू एरिया ड्यू टू एजुकेशनल एंड अदर बैकग्राउंड्स तो वो वेरी कर सकता है. इसलिए हमें ऐसी स्टडी कंडक्ट करनी है जो कि हम जिसको जनरलाइज कर सकें, जिसको सब के ऊपर इम्प्लीमेंट किया जा सके. और इसके अलावा जो हमारे पास टेस्टिंग मेथड्स हैं वो सही नहीं है. हमारे पास जो टेस्टिंग मेथड था वो स्क्रीनिंग किट थी, जो कि इनिशियल हमारी ये पहली रिसर्च है पाकिस्तान में, तो इसलिए वो हमने यूज़ की है. बट इसके लिए जो मोर प्रिसाइज़ हैं जैसे PCR या कोई दूसरी जो मेथड है उसको यूज़ करना चाहिए ताकि हमें एग्जैक्ट पता चल सके. और जो सैम्पल साइज़ है जैसे प्रीवियसली बताया गया है कि ये एक एरिया से है, तो सारे एरिया से सैम्पल साइज़ लेना चाहिए और ताकि हम इसको जनरलाइज कर सकें और इसकी इफ़ेक्टिवनेस को बेहतर किया जा सके. जो हमारे पास सिक्योरिटी पर्सनल्स हैं उनके ऊपर काम किया जा सके, और इससे ओवरऑल जो हमारी कम्युनिटी है उसमें भी बेहतरी आएगी, और स्पेशली हमारे जो सिक्योरिटी लैप्सेस होते हैं, सिक्योरिटी के प्रॉब्लम्स होते हैं, तो उनको भी बेहतर किया जा सकता है. थैंक यू.